Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video, I'm going to share with you two easy ways to stretch out your quadricep muscles. So these are the muscles in the front part of your thigh, your quadriceps. The main important one that you're going to be stretching is the rectus femoris muscle, a long muscle that crosses both your hip joint and your knee joint. So when you're stretching, this is one of the main muscles and areas that you'll feel being stretched. Now I do want to differentiate between stretching your muscles and also just doing range of motion activities at your knee. So sometimes for the majority of exercises you do for knee range of motion, for bending and flexion, are really focusing more specifically on the knee joint, and the limiting factor is going to be the soft tissue, the scar tissue, swelling within the actual knee joint. When you're stretching, you're focusing more on muscle flexibility and trying to stretch out the muscle and the soft tissue surrounding the muscle as well. So for these exercises, the limiting factor is going to be the muscle, and you're going to feel it more in the muscle belly of your quadriceps rather than feel it limited by the actual knee joint, hopefully. All right, so the first way that you can stretch your quadricep muscle is laying on your stomach. So you can either have someone help you with this, or if you want, you can use a stretching strap, or if you have a bed sheet or a towel that you can roll up, that works well as well. And some people also could use such as a dog leash, works very well too. And you're going to get on your stomach, and the goal is to have the strap or whatever you're using wrapped around your foot. So sometimes what you can do is have it so you have on both sides like this, and then kind of come around and twist it around as you come. Another benefit with the stretching strap is they actually have these loops you can use, and that's how I like to do it. I just like to put my foot into the loop and then come onto my back. And you're going to want the strap or whatever you're using to come up over the shoulder on the same side. So you almost create sort of a pulley system. And then all you're going to do is you're going to bend your knee, and you're going to try to bring your heel to your touching your bottom. And when you get to the point where you feel like you can't really go any further, you're just going to put an extra little pull on the strap and try to bend the knee just a little bit more. And you should feel the stretch on the front part of your thigh, right in the quadricep muscles. You want to get to where you feel kind of a moderate intensity stretch. Shouldn't be painful or too uncomfortable, but a little bit of a stretch, a little bit of discomfort is okay. And you want to hold this for about 30 seconds or so. And then you can relax back down, relax for a couple seconds or so, and then come back up. Usually I'll recommend people do 1 to 3 repetitions, and I would focus on stretching both sides, even if you had surgery on just the one side, just to, make sure you have good mobility on both sides and good flexibility as well. And then go ahead and bring it back down. A couple of things to keep in mind are, one, getting into this position may be a little uncomfortable, especially initially after surgery, and you may benefit from having your physical therapist or your trainer or a friend or family member help you get into that position and use their manual assistance to help provide the stretch. Just be sure you're giving plenty of feedback. You don't want them to push too hard that it's causing pain and discomfort, but still getting a good benefit and a good stretch from the activity as well. Another way to stretch your quadricep muscles is in standing. So typically what I like to do is have a surface or something to hold on to. We don't want to make this into a balancing activity. We want to focus more on just the stretching aspect. And again, so what you can do is you're going to take the leg that you want to stretch, and you're going to bring your heel up towards your bottom. And if you can grab it with your hand and just pull your heel towards your bottom like this. should feel a nice stretch in the front of your thigh. You want to keep a good posture with your back. You don't want to slouch or you don't want to overarch it too much. Try to keep a nice upright posture. To get a little bit more stretch, you can extend your hip or come backward like this a little bit. You'll notice a little bit more intensity in the stretch. And again, you're trying to hold this for about 30 seconds. Now, for some of us with knee pain, knee discomfort, if you're just had your surgery, knee replacement surgery, it's probably really difficult to get that amount of motion and get up into this position. So again, you can utilize the strap. You can either do it, so again, wrapping it around, kind of either the ball of the foot or the ankle works as well, and pulling up this way. Or another option, of course, with the strap is you have the loops, and you can just stick the foot in the loop. And of course you can sit down to do this if you need to. And almost again making that pulley coming over the shoulder like this. And again, this can be a little uncomfortable initially. That's very common and nothing to be worried about. You want it to be the point where you're feeling that stretch in the front of your thigh, but again, shouldn't be causing any increased pain or discomfort necessarily. And again, you want to focus on trying to do both sides, even if you had the surgery on just the one side, just to make sure you have good flexibility and good mobility in both legs. So that's 2 ways that you can stretch your quadricep muscles, again focusing on the muscle flexibility of those muscles in the front of your thigh rather than the actual specific mobility at the knee joint. Thank you very much for watching and have a great rest.